You're listening to Battling Opioids, the podcast. Battling Opioids, the podcast, now on Apple Podcasts, Stitcher, Google Podcast, TuneIn, Amazon, YouTube, and now radio.com.
A new study finds that the opioid crisis has cost the U.S. economy $631 billion over the past 4 years. The Society of Actuaries released its report Tuesday. It found the highest cost was in lost earnings for those who died in the crisis. Next was healthcare, a cost borne largely by Medicaid and Medicare. The Society's tally was higher than a cost estimate contained in a 2016 U.S. Centers for Disease Control and Prevention study, but lower than one from the White House Council of Economic Advisors in 2017. The report was released less than a week before the first federal trial on the opioid crisis is scheduled to begin. Presented by Battling Opioids, a project of Pennsylvania Public Media. Pennsylvania's Auditor General is trying to quantify the impact opioids, specifically fentanyl, are having on the Commonwealth. VIA's Katie Meyer reports his office's new study says in 2017, at least $178 million tax dollars went toward Medicaid recipients' opioid-related hospital stays.
Eugene DePasquale notes it's hard to measure the scale of the economic impact fentanyl and other opioids have had on Pennsylvania. He says it certainly goes beyond Medicaid costs.
Somebody that does not have health insurance that shows up at the emergency room. Plus you have the strain on 911, you have the strain on law enforcement.
But his report does point out some statistics that contextualize the scale of the problem. It estimates, for instance, that about 2/3 of opioid deaths in the Commonwealth are related to fentanyl. The Department of Health says the overdose death rate does seem to have slowed in the last year. But DePasquale has recommendations he thinks will lower it more, like legalizing fentanyl test strips so drug users can check for contamination and expanding Medicaid-assisted addiction treatment.
That needs to change, and the General Assembly has the power to make that happen.
In the House, a bill has been introduced that would legalize fentanyl test strips. It has bipartisan support. Katie Meyer in Harrisburg.
Presented by Battling Opioids, a project of Pennsylvania Public Media. Pennsylvania's Auditor General has released a report on the financial impact opioids are having on the Commonwealth. Eugene DePasquale focused mostly on fentanyl, a powerful synthetic drug that, he found, is a factor in about 2/3 of the Commonwealth's opioid deaths. To curb those deaths, DePasquale is using the report to urge lawmakers to legalize fentanyl test strips.
Unfortunately, fentanyl test strips are currently illegal in Pennsylvania because they are considered drug paraphernalia.
DePasquale says it's hard to measure the scale of fentanyl's economic impact. His report estimates that in 2017, at least $178 million tax dollars went to Medicaid recipients' opioid-related hospital stays. Those stays were 23% more frequent in Pennsylvania than the national average between 2012 and 2016. HIV diagnoses among people who inject drugs have risen sharply, though the Department of Health does say the overdose death rate seems to have slowed in the last year. Presented by Battling Opioids, a project of Pennsylvania Public Media.
Recovery starts with a call. Call 1-800-662-HELP or visit battlingopioids.org.
It doesn't take long to become addicted to opioids. 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%. And we've opened 4 medication-assisted treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/haveenough.